Hello, my name is Beatriz Domínguez-Gil. I'm the Director General of the Spanish National Transplant Organization, which is the agency in charge of donation and transplantation in Spain. And I have been living the Declaration of Estambul almost from the very beginning. I had the occasion of participating in the summit that took place in 2008. I had the pleasure to co-chair, the honor to co-chair the DICG for several years, and very importantly also to be involved in the update of the declaration in 2018.
And I'm honoured to be here with Dr. Domínguez-Gil. My name is Dr. Georgina Irish. I'm a transplant nephrologist based in Adelaide in Australia. I became involved in the Declaration of Estambul custodian group a number of years ago when Toby Coates invited me to be involved in a registry project, and I now am a council member.
So Georgina, we're supposed to be having this conversation on the Declaration of Estambul 16 years after it was adopted. And it has, when we are asked about what did the declaration reach, if I had to choose one thing that to me was astonishing was the progressive change in the views of professionals on their own role, not that much in preventing activities, but actually in combating activities. In the very beginning, there was a huge reluctancy to the doctors reporting cases, but over the years we've seen that somehow professionals understand that they have a role. And I wanted to ask you about all the assessment that you have done based on this change of opinion over the years about the reporting of cases, all the work that you have been leading in Australia. And maybe I can tell you also what Europe is doing in this regard.
Yeah, thank you. It's a great question. And I think, the biggest barrier we face with travel for organ transplantation is we really don't know how much of it's occurring. And if we don't know how big a problem is, how do we quantify it, but then how do we advocate for it and find solutions to address it? And I think there's been a lot of discussion over the years, like you've said, about whether we could have an ad hoc case reporting registry to find out more about these cases. But there was always a reluctance whether people would really use a registry. And so led by Professor Dominique Martin, and the idea established by Toby Coates, we undertook a survey of health professionals at the end of 2022, and it was published earlier this year in Transplantation Direct, which looked at whether people were willing to report cases and how they would like to report cases. And one of the predominant findings was that people would prefer to report cases through already established mechanisms, through national reporting mechanisms to an international registry. And so I think this should be what the DICG promotes as the primary mechanism for reporting these cases. I think there still is potentially a role for individual case reporting, because what we did also find from the survey is why that would be the best mechanism, and that's what the DICG should support. Lots of countries lack already established national infrastructure. And so whilst we're in the process of developing and promoting that international infrastructure, perhaps this can be another mechanism. And so that's why there's an intention to have a pilot registry and see if people actually use a case registry to report. But I'd be very interested for you to talk about your experience in Europe with establishing better reporting mechanisms.
Well, thank you, Georgina. In fact, I was very inspired by the results of the survey, because in Europe, in reality, what we try to do is to establish national and official mechanisms of reporting. So this was an initiative of the Council of Europe. The Council of Europe represents 47 European countries, so it's not the European Union, it's a completely different organization. And there what we did was to promote the designation of what we call a national focal point at the Ministry of Health level. And this national focal point has several duties of training professionals, liaising with law enforcement agencies and other ministries, But among others, one of their duties is to compile data on travel for transplantation, and importantly, without judging the cases, which was something that we have discussed for many years at the DICG, because there is proper travel for transplantation and unethical travel for transplantation as well defined by the Declaration of Estambul. So what these national focal points do every year is to get in contact with their transplant centers and compile information about patients who travel for transplantation abroad, non-resident living donors, and non-resident recipients from live organ donors. So there is different sort of profiles of cases from which individual data are collected. And then all that information is placed under a common registry that is managed by the Secretariat of the Council of Europe. So apart from helping us to, as you said before, try to dimension the phenomenon, to give a view of what is the volume of cases who travel for transplantation. Based on individual data, we are able to classify them as proper or non-proper travel for transplantation, which gives an added value. But I would say that besides mapping the problem, it goes a little bit beyond, because it forces national focal points and ministries of health to take responsibilities on their findings, because if they identify that patients are traveling to other countries or are returning from other countries, they need to get in contact with those destinations and understand whether something is going wrong and something needs to be done at a national level. So somehow it builds upon professional practices, and then but also forces the authorities and the countries to take responsibilities. And one good thing is that I believe the two initiatives have been communicated to one another, and we are reaching very similar conclusions. But it is true that if you don't have a national mechanism in your country, you should be providing these professionals with a tool to at least report that something is happening there.
How do you think that we could expand this to other areas of the world, because you've got such a fantastic mechanism?
Well, in reality, the problem of an initiative that is European and not global is that usually non-European regions are more reluctant to enter into this sort of data collection, though it is open to other countries that are willing to join. So I would say that on one hand we should promote and foster that authorities in countries do develop these mechanisms. They might be joining to this international data collection, or maybe we should establish something parallel but coordinated with the Council of Europe data collection, so we can cross-check information collected by the two mechanisms, I understand. But in your survey, what was in general terms the attitude of professionals towards reporting? Because I understand they always have the duty of secret, of responsibility towards the recipient they care for. They may consider it is not appropriate to their codes of practice to report the cases. So what were your findings in this regard?
People who completed the survey wanted to report the information and felt that a registry could be beneficial, but they were concerned, or they identified barriers were potentially harm to their professional careers or themselves, or harm to patients, and they were the biggest concerns. And probably the biggest take-home message was 50% of people wanted to report anonymously because of those concerns. And I think they will be the potential barriers that we will need to overcome to ensure ongoing future reporting.
We usually talk about the data reporting in general terms, but in reality there are two different objectives of data collection that might modify the attitude of professionals or that might be tackled in a different manner. Because of course, we want law enforcement agencies to take action when there are unethical, illicit practices taking place. But I think splitting these two objectives, do you think it is important to make such separation?
Yeah, I think that distinction is incredibly important because, as healthcare professionals, we don't enforce the law, and the purpose of these data collection is more for reporting on and understanding the prevalence of these activities and being able to use this for advocacy. I think you've completely rightly highlighted that you should never collect data if you don't report on it. But at the same time, we have to ensure that this is done in a safe way to protect the people who are reporting and also the patients that people are reporting about. And so any sort of data must be presented in aggregate to ensure that it's anonymous and not identifiable in any way, but still be used to actually affect change, because collecting of data without action is pointless. Yeah.
I'm glad that we focused on a very specific aspect that the declaration has been changing over the years, which is this attitude towards data reporting. So I look forward to our cooperation with these mechanisms that we have been designing over the years, and I think that's going to be helping a lot in the combating of organ trafficking in the future.
I agree.
A pleasure to discuss today with you.